Hi, everybody. It's Emily McFarland, Mayor of the City of Watertown. And we're here today to share some news with you about the virus in our community. First, I'd like to introduce the people that I will be presenting with today. First, you'll hear from our health officer, Carol Quest. And then next, you will hear from the CEO of Watertown Regional Medical Center, Richard Keddington. The city has been incredibly collaborative and proactive in our approach to combat the COVID-19 disease. We have been enforcing orders. We are erring on the side of health when we're not quite sure where the orders are gray. And we are working 24/7 to make sure that our community is informed and as safe as it can be. I'm sharing with you today that the City of Watertown has its first positive COVID-19 case. The patient is in isolation and is receiving the appropriate care. From the moment that we knew of the test, our health department instantly mobilized and started doing contact tracing. And our health officer, Carol Quest, is here today with us to help explain what contact tracing is.
Disease investigation and contact tracing is the work of public health. Individuals in close contact with a person with an infectious disease like COVID-19 are at a greater risk of becoming infected themselves and potentially infecting others. Contact tracing is important because identifying individuals who may have been exposed to an infected person can help to prevent further spread of disease. Contact tracing has three major components. Contact identification. Once an individual is confirmed to be infected, it is important to identify any additional people with whom that person came in contact with while contagious. This may include family members or any other person who may have been in direct contact with the infected individual. Contact listing. After identifying contacts, it is important to reach out to these individuals to inform them of their contact status and inform them of any important next steps. In the case of COVID-19, it is also important for contacts to self-quarantine to prevent additional spread. And contact follow-up. Continued follow-up with contacts is necessary to monitor for symptoms and ensure proper measures are taken to prevent spread of infection. Now Richard Keddington, CEO of Watertown Regional Medical Center, will talk about the measures the hospital is taking.
First, I want to thank Mayor McFarland and Carol Quest for their leadership. I do think the city is in good hands with their leadership and appreciate them and everything they're doing. From the hospital's perspective, we want to reassure the community that our hospital is prepared and that the appropriate plans to detect, protect, and respond have been put in place. We've been preparing for the potential of COVID-19 in our community for many weeks, building upon a robust emergency operations plan we've had in place year-round. Per CDC guidelines, testing requires a physician order, and going to physician does not automatically mean you need testing or that you'll receive testing. Prior to ordering a COVID-19 test, physicians may order tests for other infections or viruses. If those infections are ruled out, the physician or your provider will help you determine the next step. I'd like to take this moment to thank the employees of Watertown Regional Medical Center, the medical staff, and the teams for their tireless efforts to prepare for the potential of the COVID-19 in our community. As a hospital, we are prepared for this. We have highly trained staff that are ready and able to serve the community. I just want to thank them and let you know that we stand ready to serve your family as the need arises. Mayor McFarland, why don't you finish up for us?
So the message for us today remains the same. Stay at home. You are safer at home. And when you're not sure if you should go out, ask yourself, is this essential? And if it is, make sure you're practicing appropriate social distancing. Also ask yourself, am I willing to get or potentially spread COVID-19 by going out into the community? When you're at the grocery store, make sure we're maintaining that 6 feet of social distancing. If you stop at the convenience store to pick up your milk and your bread, make sure you're in and out and we're not staying in there scratching lottery tickets or talking with our neighbors that we haven't seen. Second, make sure that you practice good hand washing and hand sanitizing and cleaning those high contact, high traffic areas. Things like your cell phones and your keys, those things that you're picking up and putting down and touching pretty consistently. We want to make sure that we're cleaning every single day, multiple times a day. Important, if you become symptomatic, contact your healthcare provider. And if it's an emergent situation, contact 911. And please be honest with us when we ask you questions to potentially screen for possible respiratory illness. We want to make sure that we can protect you and protect our first responders. If you are in a vulnerable population, please do your best not to go out. We have a wealth of community resources and volunteers that want to make sure that you have exactly what you need in your home and that you can stay safe in your home. If you're unsure of what those resources are, please give a call to our COVID-19 hotline or call us at City Hall and we will make sure that you get whatever it is that you need. While we did not have a positive test in Watertown until today, the virus has been here. And we need to live our lives thinking that. So talk to people in your life about this virus. Talk to people young and old and everyone in between. There is a faction in this community and in the country that doesn't believe the severity of this illness, and that is what is dangerous to us. So do your part in ensuring that people in your household and in your circles are understanding the importance of social distancing and are understanding the importance of the safer at home order. I know it's uncomfortable. I was picking up something recently and saw two young ladies together, close together, and I battled with myself and approached them and said, ladies, stay 6 feet apart. And I know that can be uncomfortable, but that's the type of stepping forward that our community needs for us right now. There is a projection that the state of Wisconsin will peak potentially somewhere near the end of April. But what's important for us is that doesn't mean the virus is over then. That is a moving target, and even if we do peak then, it's important that you level set with yourselves that we are in this for the long haul. We have a lot of resources on the City of Watertown website and on our Facebook page, everything from what to do with your family to how to help support your business during this time. So talk with your family and prepare yourself for a solid month, probably more, of living this new normal that we're living. I've talked at length about flattening the curve, and this is it. The time is now. We need to step forward for our community, and we need to step forward for our healthcare providers who are stepping forward for us every single day. So do your part, stay at home, and stay safer at home. I would be remiss to not thank our first responders, our healthcare professionals, and all of those supporting them, our Watertown Department of Public Health that has been an absolute solid rock foundation during this entire process, to our manufacturers who are stepping forward and providing us hand sanitizer and cleaning machines for our election day booths, and all of the industries that are serving in an essential capacity. We could not do this without you. But I will tell you, I'm not surprised. We have an incredibly compassionate and supportive community, and this virus and this pandemic has proven that time and time again. I know that we will persevere through this, and I know that we will come out stronger than we started, and I know that because I'm already seeing it. I know this is going to be tough. It already has been tough, but we're managing to persevere, and I know we will. I know we can, and I know Watertown will as well. Stay healthy, everybody, and we'll talk with you real soon.